one very important subject that came up during the workshops was that of roles and boundaries. I want to talk about what boundaries exist in the osteopathic patient relationship, and also speak a little bit about the role of an osteopath and ways in which patients may try and pull the osteopath out of role. So boundaries, the osteopathic boundaries would be things like the room, the space that you're in, the time that you allot per treatment, the fee that you charge, and the role. Would you say the role is one of the boundaries?
Yes, you could say role, although they tend to be thought of as different things. But certainly the role has got boundaries.
The role has got boundaries. Okay.
Yeah.
So it's very important that the osteopath is aware of the boundaries.
Yes.
And sticks to them.
Very, very important.
So what is a boundary, and why are boundaries important? What does it mean when they are broken?
Yeah. Well, if you think about it, boundaries are everywhere in life. It might be a physical boundary, like a wall, the walls of a room and a door, or it might be a space. May also be a boundary, like, for instance, at a hospital. The accident and emergency part of the hospital is a boundary in which patients are diagnosed and decisions made whether they should go home or go somewhere else or go into a ward in the hospital. So the accident and emergency serves as a boundary around the hospital, you might say. Now, sometimes boundaries are hard, like airport boundaries, the security, passport control, all of that is a hard boundaries. And sometimes they're psychological. They might simply be an awareness of this is where I end and you begin. Not just in physical terms, but also in emotional terms.
Okay.
So now in the osteopathic situation, the boundaries, as you say, are constituted by all these elements of space, time, fees, and task. You've also got a task, and then there's the role. Now the task is to attend to the patient's physical pains, which might mean putting hands on their bodies. Now, normally we don't do that in society. We recognize a boundary between people, spatial boundaries, psychological boundaries, and we generally don't violate them, generally speaking. But in the osteopathic setup, you've got your hands on the patient's body, sometimes in very sensitive places, which the patient might have feelings about. So how you manage that boundary, those boundaries around touching and manipulation and massaging and twisting and so on, all of those are very much part of your skill. I
mean, that sort of boundary is more obvious why it shouldn't be broken.
Yeah.
But what about something like timekeeping?
Yeah.
Or fees or those kind of things.
Well,
or role as well. Like with some patients, you find yourself being more pally with them than others. Is that okay? Is that dangerous? Some you might meet socially.
Correct. Well, again, you can't avoid sometimes these things happening. Even with your doctor, you might meet them socially or whatever. But there is a case to be made about preserving boundaries, not being pally. Timekeeping is an important one. Fee paying is another. And maintaining those boundaries is important.
Why?
If you become lax in boundary keeping, the professional relationship and all that goes on in it can unravel.
Sometimes I feel when I have become too talkative during a session, where the professional side of it has become a little bit blurred. Often those are the situations where the patient doesn't react as positively to the session. I find sometimes that can happen.
Sure. And it may also then be more difficult for the patient and for you to speak about those transgressions, you might say, or dissatisfactions.
In one session we had, there was one of the osteopaths gave an example where she had come drastically out of role and had started doing the shopping.
Correct.
For one of her elderly patients.
Correct.
I don't remember if she herself realised this or it was the group that helped her realise this, but the realisation was that she was making up for the guilt of not being able to attend to her own elderly parents who lived some distance away, and how that was sort of what was pushing her towards...
Indeed. So indeed, collusion in the breakage of boundaries may have more to do with problems in the osteopath's life or pressures in the osteopath's life. But there's a collusion because the patient also brings their desire to break a boundary. So the patient who asks the osteopath to do their shopping would certainly be a boundary violation in my view, because it's not the role of the osteopath to go and do shopping for patients.